The technique we will be demonstrating is a thoracic distraction manipulation to the mid-thoracic spine. According to Dan Pinto, a manipulation is a grade 5 mobilization, which is a high-velocity, low-amplitude thrust performed at end range of the joint capsule. A distraction manipulation is one in which the force is applied such that the joint capsule is opened up. In this case, for the thoracic spine, that force applied by the therapist is in the inferior to superior and anterior to posterior directions. This is because the thoracic facet joints are oriented in the frontal plane 60 degrees anteriorly from vertical, causing the superior facet joints to face superiorly and posteriorly. Structures affected by this technique include the joint capsule, local musculature, and neurophysiological pathways. In the joint capsule, this manipulation can help to release entrapped synovial folds and disrupt articular adhesions. For local musculature, hypertonic muscles can be relaxed by a sudden stretch. Specific muscles that could be affected in this particular technique include erector spinae, multifidi, or rotatoris. For neurophysiological pain pathways, centrally it can activate diffuse descending pain inhibitory systems, and locally it can activate presynaptic inhibition of afferents from the skin. During this technique, it is possible to also get a cavitation, or a popping sound. A cavitation occurs when the forceful thrust creates a decrease in pressure in the joint, causing a sudden displacement of joint fluid into the low pressure area in the joint. This sudden movement of gas and liquid is what creates the sound. Indications for this technique include a painful joint due to articular pain or muscles, joint hypomobility that is caused by a tight capsule, adhesions, locked or impinged joints or tight muscles, clinical prediction rule findings, or to facilitate local musculature. Contraindications are destructive bone disorders, avascular necrosis, malignant bone tumors, infection of the bone at the joint, fractures, anatomical dislocation, cauda-equina syndrome, or an unwilling patient. To perform this test, the patient is seated on the plinth with therapists behind them. The patient is instructed to interlock their fingers behind their neck. For the mid-thoracic spine technique, the therapist then moves the patient's elbows to the front of the body and grasps both elbows in cupped hands. The patient is then asked to relax into the therapist. The therapist then lifts up and back, creating a traction force until tension is taken up completely. Patient is asked to take 1 or 2 slow, deep breaths. The thrust occurs as the patient completely exhales. The thrust occurs in an inferior to superior and anterior to posterior directions in order to distract the target segments. This technique is done typically once during a treatment session with high velocity and low amplitude force. It may be done on every patient visit if still indicated. Expected outcomes include decreased pain in the shoulder, cervical, and thoracic regions, increased range of motion in all planes of motion of the joint, decreased muscle spasm, and hearing a cavitation.
Okay, Libby, I think you're having some of the pain in your back because you're really tight in your thoracic spine. So that is here in the middle of your back, these vertebrae here. And so what I'm going to do for treatment is called a distraction manipulation, just to try to loosen up some of that tightness in the back, okay? So you have all these vertebrae in the back stacked on each other, and the distraction is just going to kind of separate them and create a little more space quickly. And then just hopefully loosen up some of the muscles around and stuff, okay?
Okay.
You might hear a pop, and that's completely normal. That's just, you have fluid in between each joint, and that's just the fluid moving around, okay? Do you have any questions?
No.
Okay. So what I want you to do is sit back on the table, and you're going to lock your fingers behind your neck like this, kind of like a collar. And you're just going to lean back into me, and I want you to relax, okay? Lean back, and then take a deep breath in, one more time. And how do you feel?
Feels a lot better. Thanks.
Okay, so I think we're just going to do that today. Hopefully you'll feel looser throughout the day. You're just going to let me know when you come back next time how you feel afterwards, and we may or may not do it again next time, okay?
Thank you.
Yeah, you're welcome.